What happens to your child if you are pregnant with HIV? You as a mother, if you have HIV or if you are HIV positive, will your child be also HIV positive? What will be the fate of your child if at all you deliver your baby? This is a question that have got a lot of people confused and they don't know what is the solution. Is it even possible for you to carry your baby from 0 age to the 9 months and deliver him or her successfully without getting infected? Stay with me in this video and I'm going to explain to you what happened during pregnancy with HIV. A lot of people will not tell you this, but I'm going to tell you, and you understand vividly how HIV pregnant women can deliver their baby successfully, or maybe they can't deliver their baby successfully. I will explain everything to you. So if you are just coming across our video for the very first time, make sure you subscribe. If you are a returning subscriber, make sure you like as usual, comment your questions, and let's dive into this. What happened to the baby? To a mother who is HIV positive, what happens during pregnancy? Yes, there is very high risk or high chances of a baby getting infected from the mother. That is what we call mother to child transfusion or mother to child transmission. There's tendency that your baby gets infected in these following ways. Aside these ways, your baby can never be infected during pregnancy. During pregnancy or during the intrauterine life, there is mother to child supply, blood supply. So there are blood supply that supply to your baby during that stage, which even make your baby to grow or to develop. So during this stage, there is tendency of this HIV to transmit to your baby during delivery. When you are delivering your baby, there's tendency that your HIV status is being transmitted to your baby only on one condition, provided you have a healthcare provider that can handle your delivery very well. Most preferably, CS is recommendable, that it can help you, and there are certain guidelines and procedures they can put in place to separate the umbilical cord from the baby and from the mother, to avoid mother to child transmission. So aside these guidelines, if these guidelines are not being followed, there is high risk and high tendency that your HIV status is being transmitted to your baby immediately after delivery. That is number one. Then another way in which mother can actually transmit this HIV or her HIV to that of the baby is during lactation. Yes, that's during breastfeeding. If at all you as a breastfeeding mother, you are living with HIV currently or presently, or maybe you don't know before and you are living with HIV, there's a very, very high risk of you transmitting this HIV virus into this baby. That is, the human immunodeficiency virus is being transmitted from mother to child during breastfeeding. A lot of people might not know, because whatever you take in, be it food, drugs, or anything that affects you as a mother, similarly, it also has impact on the baby. So during breastfeeding or during breast milk, there's high tendency of a mother to pass on this HIV from herself to that of the baby. Then in the stage of a baby, when the baby become a toddler or the baby starts crawling, and you as a mother, you are making use of sharp objects. So those sharp objects, they cut your hands and they become contaminated. And if at all this baby come across these sharp objects like razor blades, knife, or any sharp object at all, needles and the rest that are contaminated already, if they come in contact with those sharp objects and they also make use of it, there is high chances and there's high tendency that they also get infected through this sharp object. Precaution is very, very necessary. You as a pregnant woman, it is also very, very advisable that during your antenatal care or during your antenatal services, confide in your doctors if you've been confirmed with HIV before, so that they can plan the guidelines for your delivery or how they can make your delivery successful for you. Or if at all you've not been tested or your doctor have not tested you, when you go for antenatal services, make sure that you recommend or you ask your doctor for it. More also, all healthcare providers should make it mandatory to be as part of their routine. Now, whenever a woman is registering for antenatal services, they also include HIV. They should make sure they do that test to confirm whether the woman or the pregnant woman is seropositive or seronegative. Because you see that most of the women, they are seropositive and they don't even know why they are pregnant. So to avoid the complication that may come from it during pregnancy, it is recommended, it is necessary that you recommend HIV test for every pregnant woman in the facility. You will meet again in our next video. Always make sure you practice the safer method, having sexual intercourse, protected sexual intercourse. Don't have a multiple sexual partner, or if you are in a high risk area, or you're a social worker or you worked in the barrack, these are the people that are high risk. Always make sure you take precautions against HIV. HIV is something that you should not play with or you should not joke with. It is very, 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 very dangerous, and for now, scientists are still proving on how they can cure it, but it is still incurable. So make sure you take care of yourself, take good care of yourself, take safety precautions, and if you are confirmed, make sure you are regular with your drugs. To wait again in our next video. This is a video YouTube is suggesting for you to watch next. Click on this video and I will meet you there.